Good evening. I'm Mayor Ron Nirenberg. We're joined by Bexar County Commissioner Trish DeBerry. And another special guest today, we have our very special guest, Archbishop Gustavo Garcia Siller, who will be talking a little bit about the vaccination process that he's gone through. And we're also joined by Dr. Rita Espinoza, who is our Chief of Epidemiology, and this is our COVID-19 update for the San Antonio community. Today's vaccination report shows that 955,976 individuals have received at least one dose of the COVID-19 vaccine, and here in the county, 719,767 people are fully vaccinated. These are very good numbers comparative to the rest of the state and the country. This means that we now have 63.5% of our population who has received at least one dose of those who are eligible, and 47.8% of people who are eligible are now fully vaccinated. We continue to exceed both the state and national averages again. Adolescents aged 12 through 15 are now eligible to receive the Pfizer vaccine to help protect against COVID-19 after the CDC endorsed the vaccine for that group on May 12th. Beginning tomorrow, Friday, May 14th, Metro Health will offer the Pfizer vaccine to adolescents at the Alamo Dome. Again, consent from a parent or legal guardian is required for 12 to 15-year-olds to be vaccinated. As a reminder, people 12 and up can get vaccinated without an appointment at the Alamo Dome drive-through clinic between 9 a.m. and 6:30 p.m. Tuesdays through Saturdays. It's important to note that only locations providing the Pfizer vaccine can administer it to that age group. If you prefer to book an appointment, they are also available by going to covid19.sanantonio.gov or by 11. Remember, you can also sign up for the text alerts to let you know when appointments are available by texting vaccine or vacuna to 55000. Let me turn it to Commissioner DeBerry.
Thank you, Mayor, for the opportunity to be here on what I would consider really a watershed day in the history of this pandemic, and that is the recent news by the CDC regarding guidelines that if you have been fully vaccinated, you do not need to wear a mask at indoor or outdoor gatherings, nor do you have to social distance. So, very good news, room for optimism, room for joy, and for the myriad of people that have come to me and said, I don't understand why I still have to wear a mask when I've been fully vaccinated. Woohoo! This is a day of celebration associated with that announcement. I even heard the president say that today. Secondly, the good news about the CDC guidelines is for those that have been reticent to get their vaccination, you should really have no excuse. I mean, this is one more reason why you should go and get vaccinated, because you don't have to wear a mask. So with that, I would tell you that the CDC guidelines that also came down this week regarding the age group of 12 to 15, I had a conversation with George Hernandez, the CEO of University Health Systems, today, and as of last night, we have vaccinated 500 of those in that category. Understand that that category represents not only 17 million Americans, but 12,000 here in Bexar County. And really, the opportunity to move fully past this pandemic is the vaccination rate. As the mayor alluded to, we have one of the best vaccination rates in the state. So let's keep it up. Mad respect for our community for taking this very seriously, because we all want to be able to celebrate. And for going back to school, that young age group, although it requires the permission of a parent, I had a conversation with superintendents this week. We want to return to a state of normalcy when kids go back to school in the fall. So keep vaccinating your young ones and your children, because we are very cognizant of the COVID slide. Learning online is not the same as learning in the classroom, so we need to make sure, like I said, we continue the rate and the clip that we have gained throughout this pandemic. So lastly, Mayor, what I will tell you is I will be having a conversation. This is the order at county facilities regarding wearing masks. I will be having a conversation tomorrow about really what we're doing regarding not wearing masks anymore in county facilities and operationalizing what the CDC has put forth. So I know we'll have joint conversations between the city and the county about that. And right now we are blessed to have the Archbishop with us tonight. So I want to turn it over to you. We're grateful to have you here tonight.
Thank you, Commissioner. Thank you, Mayor. It is really a very beautiful gift and to be vaccinated. I myself have been already a couple of months since I took the 2 vaccines, and the sense of interacting, the sense of building community has been much easier. With this update that we just received, we are grateful, and I invite all of you who are following this update to be sure that you and those around you receive the vaccine. It is true that it is a personal benefit, but also we are doing it for the sake of others. And there are always someone around us that is more vulnerable. So it's a responsibility, and in my case as a religious leader, it's a moral responsibility to take care of ourselves and others. And solidarity in this case is very important because, as we just heard, is freer, and we can build a better society if we are sure that we are taking care of our health and that we are mindful of those who are next to us. We have many parishes here in San Antonio, and those parishes who have taken the initiative to promote the vaccine, I visiting them for worship is easier to pray, is easier to celebrate, is easier to live, to breathe, and to keep ourselves in good health. Los invito a todos los que nos están siguiendo por esta programación a que busquen los caminos para adquirir la vacuna. More than ever is accessible. Más que nunca es accesible, está a sus puertas. Digan sí a este paso de hacer el bien a sus personas y a aquellos que los rodean. Vaccine, vaccine, vaccine.
Thank you so much, Archbishop. A friend to all of us here and to our community. Very much appreciate your message this evening. I do want to get now to the COVID update on infection numbers. We are doing quite well in this regard as well. We are reporting 265 new cases of COVID-19, which brings the total again to 220,517. Our 7-day rolling average is down from last week. It is now 202. Thankfully, we have no new deaths to report tonight, but please again remember those who have lost loved ones. Keep them in your prayers this evening. And over in the hospitals, again, we're seeing a downtick there, which we're very grateful for. 200 COVID-19 patients in our local hospitals tonight. Over the last 24 hours, there were 24 new admissions. 55 patients are in the ICU, and 25 are on ventilators. As you know, we've been going through some questions that we have gotten to Metro Health on a frequent basis. Let me ask this one to Dr. Espinoza. It's now time, and I want to go get a vaccine. Will I be able to choose which vaccine I want?
To some degree, you can. As a reminder, as it was stated earlier, individuals that are 12 to 15 or older can get the Pfizer vaccine, but the Pfizer vaccine is the only vaccine licensed for the 12 to 15-year-old age group. It's also the only one licensed for the 16 to 18. So it's the one that will cover the widest age group of individuals. If you're 18 and above, in addition to the Pfizer, you can also go get the Moderna or the Johnson & Johnson. Not all locations carry every vaccine, so you'd have to really look at where you're thinking to go and look at which vaccine they have available if you're looking for a particular vaccine to get. So they're not all at all the different locations, so you need to plan ahead.
Great. Thank you very much, Rita. And finally, a quick note. Again, if you are struggling through this pandemic, paying rent or mortgage or looking for work and would like to train for a job, our assistance programs are available at covid19.sanantonio.gov, or you can call 311 for more information. And as you know, mobile clinics that are giving vaccines are coming out to communities near you, but please do not wait to get your vaccine. Again, go to covid19.sanantonio.gov to get the latest on COVID as well as the vaccination process in our community. You can also call 311 or text COSA.gov to 55000. Myself, Commissioner DeBerry, Archbishop, and Dr. Espinoza are available for questions.
Our first question tonight, starting with Dr. Espinoza, please, and anyone else who wants to answer, do you agree with the new guidance on masks that came out of Washington today?
Do we agree? We agree with them. It's all based on science. It's based on evidence that has been gathered through the years and looking at what's happening since individuals are being vaccinated. So it is really based in science. I think as a city and a county, we will be meeting to discuss how to operationalize that to make sure it's as clear as it can be for the individuals.
Bruce, if I could add to that, Yeah, I think precisely because it's been based in science, we're not making this up. We talked about the vaccination rates that we have here, not just in Bexar County, but across the country. And I think the country, as well as the community, is ready to return to a level of normalcy. Do we have to proceed with caution? Absolutely. But the fact that people have been proactive about getting vaccines, I mean, they should be somewhat rewarded for what they have been able to do. So I think, you know, the obvious idea was by the 4th of July, we all needed to be celebrating without masks. So I think we're well on our way to doing that.
Yeah, and I'd add, again, credit to everyone who's been contributing to this process of getting this pandemic behind us. It's a result of people going to get vaccinated. It's as a result of people taking precautions before they were able to get a vaccine. And again, we still want them to do that if they haven't been vaccinated, but the quickest way to get back to that is to go get your vaccine. And as we've said a number of times in recent weeks, there is enough vaccine for everyone at this point. If you haven't gotten it, don't procrastinate. Go get it immediately.
Commissioner DeBerry touched on this topic in her opening statements, but could you all, the mayor and commissioner, discuss policy going forward on mask usage? Will city and county continue to enforce mask usage indoors on city and county property?
So as the commissioner alluded to, our teams are working and we'll be meeting tonight and tomorrow to operationalize the guidance from the CDC. We have been following the public health guidance from the beginning. It's great to have a coherent and unified response from CDC, so we will be following their guidance, operationalizing that in the city facilities and how we ensure that folks who are not vaccinated continue to take precautions. That's what we'll be working on the details of, but we are going to follow the CDC guidance.
Mm-hmm. So from, you know, the courthouse standpoint, we have a lot of people that come through there. I've gotten a lot of questions about masks versus not wearing masks and being fully vaccinated. As you all know, too, we are about to open up the courthouse to jury trials. So I think this will be incredibly helpful, obviously, as we move forward with that. But we need to be talking to each other, which is what I think we've done all along during the pandemic, which has been a great thing. I mean, there are a lot of people that thought the city and the county never worked very well together, but I think we have done a stellar job. So we will continue to do that.
And for the Archbishop, will the Catholic churches now require people to wear masks going forward? And if you could answer in Spanish, they'd appreciate it.
We are going to wait to see what the authorities, local authorities, convey to us. Being cautious, we will continue wearing the masks in our Catholic churches until we are sure that most of the people in our communities are receiving the vaccine. Esperamos que con el tiempo podamos dejar el tapabocas. Sin embargo, ahorita como una medida vamos a continuar hasta que las disposiciones locales y los expertos nos indiquen cómo vamos en el proceso, con la esperanza de dejar de usarla.
Can members of the panel discuss how the CDC changes will impact life in San Antonio?
Well, I think you're going to be able to see people smile again, and there's good reason to do that if they've been vaccinated. And this is another signal that, again, the community has been working together very well to put the pandemic behind us. But it's another indication that we can start to do things that we have been missing for over a year. The important thing, though, that's going to change life in San Antonio for the better is actually people getting vaccinated, and this is just another indication that that is occurring.
So let me just say, having been born and raised in this community, born in Wilford Hall, the daughter of an Air Force veteran, I know for a fact, obviously, that this is a community that loves an abrazo. We like to hug each other. We like to be able to connect with each other. And to the mayor's point, the opportunity for us to see not just the whites of people's eyes, but smiles on people's faces. From an emotional connection standpoint, this is a big step in the right direction to getting us back to the community that we are, which is hugging and embracing the culture that we have here.
We have another question for the Archbishop and request that he answered in Spanish. What message do you have for children who are afraid of getting the vaccine, and how about to parents who may be hesitant about getting it done for their children?
Well, we should not be afraid. All the information that we have been receiving, that is scientists speaking about it, give us the assurance that there are more risks not to receive the vaccine. And with the little ones, we need to find a pedagogical way how to engage them. And we are at the right time, because now we are, I think, about the 16 years old up. But we are going to come to the time that we need to address the little ones. And that was just 2 days ago with Liz, a little one, a family that I know, and she was talking about the cooties. So I don't know exactly what that is, but let's get vaccinated. And parents, they should show the way. Que nuestras familias vean la necesidad de empezar a educar a sus niños en la importancia de estar saludables y de ayudar a la salud de los demás. Y hay que ayudar siendo pedagógicos en nuestra relación con los pequeños, porque ellos captan de otras maneras y es muy importante su contribución, pero los papás tienen que dar el ejemplo.
For Dr. Espinoza, has Metro Health identified any particular communities in the city that are still experiencing a lag in vaccinations, and what are we doing to increase vaccination rates in those communities?
So every week we run a report and look at the data geographically to look at where are individuals being vaccinated, what communities are they coming from, usually at the zip code level. And then we use that data to identify where we can go out and do pop-up clinics and work with those community leaders to get the information out there, to publicize it, to get their patrons, their community members to actually go and get the vaccine at these locations. By putting these locations out in the communities, we try to reduce barriers so that individuals can't say, I don't know where to go, or I don't have transportation, or it's too difficult for me to get to these locations.
Are the mobile vaccination clinics the most important tool for vaccinating going forward?
I wouldn't say they're the most important tool, but they are one of the tools that will be important to ensure about addressing any kind of those barriers, making it accessible to individuals. But we also have vaccinations being given in multiple sites, so grocery stores and some of the pharmacies and other locations. So I think it's one more tool and it's one more way or mechanism to be able to get individuals, and then also have the Archbishop and other religious leaders and community leaders encouraging their individuals or their community members to get vaccinated. So I think it's really another tool, and it's helpful. It will hopefully show that support and encourage individuals to get vaccinated.
Does the new guidance from CDC mean the virus cannot spread from those who are vaccinated?
Currently, the evidence has shown that even if an individual contracts the illness, they'll have a milder illness, and that the possibility of them transmitting to others does not exist. So it really kind of minimizes the transmissibility to others.
Do parents need to bring certain documents for their children to receive the vaccine at mass clinics?
So at the Alamo Dome, the only thing they'll need is the consent form. They won't have to take a birth certificate or any other records to verify the age. That will be based on the information provided by the parent. I'm not sure about UHS and some of the others, whether they're requiring any other documentation. But all will require parental or guardian consent to get vaccinated.
Can you tell us how many Hispanics have been vaccinated against COVID in Bexar County?
So as of this past week, one dose, 371,371 individuals, 16 and above, are of Hispanic. And that's about 43%. And fully vaccinated is 276,910, which is also about 43%. So of the individuals who have been vaccinated, 43% are of Hispanic population.
That's all the questions we have tonight. Thank you very much.
Thank you.
Thank you.
Thank you.